Angelique Coetzee says it's better for South Africans to remain in China because when people come into the country, it's more challenging to manage the situation of coronavirus. However, despite challenges in the health sector, the minister insists that the country is ready to respond to the virus. Well, let's speak now to the chairperson of the South African Medical Associations, Angelique Coetzee. Ms. Coetzee, thank you very much for your time. Are we ready for coronavirus should it hit our shores?
Good morning. Yes, I think we are as ready as we can be when it hits our shores. The proof will lie in the pudding, because what we need to understand is that this virus is attacking people with low immune systems, especially people with lung problems like asthma, chronic bronchitis, your TB patients, your HIV patients that's uncontrolled, your elderly patients and your young children that's sick. So the problem is, because it attacks the lower airways, the lungs, as we have said, most of these patients will have to be admitted in an ICU, where they would end up most probably on a ventilator. So we need to make sure that we have enough ventilators in the public sector that is working and ICU beds. Because also, when you admit them, they will need to be isolated. And so we need to look at our beds and whether we have enough. So yes, we have beds and we have ventilators to put them on.
You speak about if and when these patients do get to the country or are eventually identified, they will have to be isolated and managed. I want us to listen for a moment to the Minister of Health, Angelique Coetzee. We spoke to him yesterday, and I want you to take a good listen to what he had to say.
The reality is that the spread of such an outbreak requires limitation of movement of people. Sometimes when we look at it, we need to understand that keeping people to be where they are, away from those who are infected, is the safest way of dealing with the disease. In this case, South Africans who are in China, none of them have reported that they are in any specific risk. There are more panic from people who are outside in South Africa, which is understandable, and we have to keep reassuring them. But should there be a situation arising that there's a need to evacuate, of course such a decision can be taken, but I think we need to understand that when people come to South Africa, it's actually even more challenging to manage the situation, where it's very difficult to restrict the movement of individuals inside the country. People will have their rights. They can only be where they are. You can only quarantine them because they've agreed. If they don't want to be quarantined, you have now got to take extra steps to prohibit their movement and all of that. So all of those issues are serious challenges that we must keep in mind as we move on. Okay. But we will be able to respond. If there's a need for that, we'll actually be able to deal with it.
Okay. Keeping people where they are is the safest way to deal with this disease. What do you make of that statement?
I agree with the Minister. The problem is that if you come into, let's say there's a ship in the harbour coming from China, you cannot keep them quarantined for 2 weeks because let's say someone is infected. So after 2 weeks, let's say on day 14, the last day of the 2 weeks of quarantine, they're now starting to have symptoms. Then you have to go another 2 weeks. And another 2 weeks. That's what's now happening with one of the ships that they are experiencing the problem. So quarantine, South Africa just doesn't have the capacity to do mass quarantine. The important quarantine is self-quarantine. So you come in, we know that there are students that came in from China now. The most important thing would be to monitor them at home, make sure that they are fine in their own environment, where it's much easier and it's going to cost less if you can quarantine them in their specific surroundings than quarantine a huge number of people sitting on a ship or coming in with a flight.
The Minister makes no bones about the challenges that face our healthcare system. You represent, in the main, a large number of doctors,
Yeah.
and they work in the public sector. What is their feeling? Just person-to-person expectations, if and when this virus does come to our shores.
Currently, there's a campaign going around in the public sector, hospitals, to try to help them to understand what to do, what is the necessary steps that needs to be taken if such a diagnosis has been made. And they're quite comfortable at this stage. But again, the problem is this is a virus that is not so deadly, but it runs so fast. And it goes for the people with immune system deficiencies. And that is where the problem is going to arise as again. Where are you going to admit them in the end? If there's 10 people in a certain place and they need to go to the local public hospital, do you have 10 ICU beds for those people? What do you do with the other people that's sick that doesn't have the coronavirus? So it's the isolation, it is the ventilation, because we know that nearly 3/4 of those patients will end up on a ventilator. So that is where our problem is going to lie. So South Africa is trying to do the best what they can at this stage. And that's why I'm saying the proof is going to lie in the pudding. In the end, when it really hits us, and I can't see that it will not, I think it will come, and we will have to wait for our winter time as well, because then your viruses are much more virulent than this time of the year.
The most worrying statement from you, just listening to what you're saying, is we do not have capacity to quarantine people in large numbers. That's very worrying. But thank you very much for making the time to come speak to us here.